You're all set.
Okay, great, thanks. Hello, everybody. Welcome to April Board of Health. We are running a few people short of quorum, so we are going to go ahead and get started with our reports, and then we'll loop back around to things that require approvals once we have a few more folks on the phone. So let's go ahead and get started with, and we have nobody for privilege of the floor today, so we'll be skipping that on the agenda as well. So let's go ahead and start with our financial summary. And Frank, are you going to do that, or just what's in the report?
I think just what's in the report. I know Brenda and Karen are getting close to closing out 2021 with the county finance office. So hopefully by next month, we'll have that finalized for you.
Okay, great. Any questions or questions for Frank, or sort of topics that you want taken back to for discussion before next time? Okay. So Frank, why don't you just keep the floor and go ahead with your administrative report?
Okay. I provided a written report because I didn't plan to be here. I was supposed to be in Niagara for a conference, but my family, like many other families, is dealing with COVID. After 2.5 years, my wife tested positive on the weekends. She isolated, and but unfortunately I had already got it. So I am positive. Thankfully, no symptoms for me. So she's recovering, doing well, and my daughter's still negative. So so far our separation in the house has worked, and we'll see how it goes. But I'm home, and we'll be working from home during the isolation time as we move forward. But case numbers are up and continue to be up in our community and region. Our hospitalizations have started to tick up a little bit. I do think that likely on Thursday, we may move to the high designation on the CDC metrics, just based on the hospitalizations that we've seen. There's not a lot of people in the hospital, but we've been having a good bit of churn, you know, where folks will go in, will be there for a short stay, and then are out. And so one of the metrics is the number of new hospitalizations per 100,000 over the last 7 days. And so those numbers have been up a little bit. I think right now, if you look at the CDC website, we're at 12 for that particular measure. And so being over 10 would push us into that high designation. So we're going to be putting out information likely tomorrow. Another press release talking about this, preparing folks. We will issue a mask advisory associated with that shift. It's not a mandate, and it's really not that much more than we've already been saying, because we've been recommending people wear masks indoors, but we will be moving to an advisory because we'll have met that metric that the CDC had put out. So hopefully things will start to come down a bit. We've been holding steady for a while at this higher level, and I'm really hoping we can turn that corner soon and start to see the numbers going down. But otherwise, I think everything else I put in my written report.
Great, thanks, Frank. Any questions for Frank? Okay. So let's go ahead and move to health promotion. And Sam is not, oh, Ted, are you here for Sam?
I'm here for
Hello.
Sam. Yep.
Welcome.
Thank you very much. Nice to see everybody. I'll just say Sam did have her baby, 7 pounds, 9 ounces, named Desmond, nickname Desi, D-E-Z-I, and everybody is super healthy. So it's great news. I'm just going to go through real quick on a couple of updates on what we posted. There was a note in our report about a KN95 mask video that with a Vimeo. There was a Vimeo link to it. We now have that on the website, and I will put a link to that in the chat. Community health assessment, we are have started, and officially will start tomorrow with the first meeting, a working group for a community survey. We did a community survey in February, March 2019. We're going to do it again, asking community what they perceive as the biggest unmet needs and biggest health risks and what they believe is a healthy community, makes up a healthy community, that sort of thing. So hopefully that's going to be out and circulating in June in time, and we'll get data back and crunch it in time for the due date of this community health assessment, which is the end of this year. Community health workers, that initiative is, I guess we could say it's launched because there are 2 community health workers who have been hired. One begins on Monday coming, and the other begins middle of May. It's very exciting. Sam and Shannon, and I guess others, were really very excited about the individuals who were hired. And so this is a great initiative, which is going to go forward and looks forward to being a really important addition and vital to the health department and mental health department as we come together. That's all.
Great. Thanks so much, Ted. Any questions for Ted or health promotion? Congratulations from us to Sam. So thank you for sharing that information. Okay, Dr. Klaypak, welcome back.
Oh, thank you.
We missed you last month.
That's right. There was a report, but I wasn't physically here. Good to be back, even though I came back just in time for winter again. So I was someplace warmer. So to piggyback a little bit on what Frank was saying about numbers and trends, about a week ago, after I wrote my report that you have in front of you, the CDC's modeling of the coming weeks came out. So as of a week ago, the end of the month of April was about 2 to 3 weeks hence. The prediction was a 92% national increase in COVID cases. That's the bad news, certainly. We aren't there to the end of April yet. Likely we're going to see further increases in COVID cases. The plus minus news was that hospitalizations, the CDC's modeling showed sort of an uncertain trend, but somewhat perhaps of an uptick to be expected. Now that we're up as to the numbers in hospitalizations that Frank mentioned, we're starting to see that. With regard to deaths, deaths had an uncertain prediction. They actually were predicted to fall with some uncertainty in exactly the trend. So what is one to make of all that? I think one makes out of it that this BA2 variant is very contagious, that it so far in terms of severity has not shown itself to be what we might fear of a variant that is a very, very severe index for it. I think it's somewhat a reflection of what we've been able to accomplish in terms of vaccination and the fact that so many people who chose not to be vaccinated were infected with Omicron in these last 4 to 5 months. But it doesn't portend that what we're seeing is going to get lighter in the near future. And I think it's best that we have our mindset prepared for that. And as Frank said, using the precautions that we've been talking about and prudently using masking and distancing and choosing, what encounters you choose to have, what gatherings you choose to go to, is still going to have to be a mindful thing that we do, that we don't go about unmindfully going about our lives. There are some numbers that I think are worthy of looking at to update the graphs that I put in front of you before. Could I share my screen just to show a couple? Let me just go to the right place here. So let's move down. I talked about hospitalizations and Frank did as well. If we look at the numbers here in terms of 7-day average new positive cases, let me keep that highlighted. You can see that since our last board meeting, there's been this trend upward, and then in the last week, a further trend upward in our 7-day average. If we look at our daily new positive cases, they of course go up and down, but there have been a lot of pretty substantial numbers in there. If we go and look at our positive tests, you can see that what we're seeing is a ever increasing trend in positive tests. Of course, this is by and large not self-reported tests. These are PCR tests by and large. And of course, it's strongly influenced by who chooses to get tested in a PCR manner. And as Frank mentioned, our community level with these metrics being what determines where we are, we're already at that more than 200. And what's going to drive it is what happens in the hospitalization numbers on a formal basis. So some somewhat good news in terms of what might be expected for deaths, and basically hospitalizations, some bad news in terms of cases. One of the things that's become apparent in the media is covering extensively this last week is whether the public is aware of medication therapy for COVID, that when one becomes positive for COVID, that there are medication options available to them. The perception is that the public is not sufficiently aware that these options are out there, nor that they should be in touch with their personal practitioner when they become positive so that they can be evaluated as to whether a medication would be appropriate for them. And then there is that small subset of our population for which there is a preventive therapy available, largely the immunosuppressed, who should already be in touch with their practitioner to discuss whether a preventive strategy is appropriate for them. So I wish to reiterate to the public, whoever is listening to this shared meeting, that they should be in touch. If they become positive with their practitioner, they should be aware that those medicines are out there. And we are doing what we can to get the word out to make sure that people are aware of it. The situation in terms of the community is that the positive COVID cases are coming across the board in terms of ages, occupations, what they're doing. Cornell's data shows that the positive cases they're seeing are not in a particular sector of the Cornell population, but are occurring amongst staff, supportive workers at Cornell, students, graduate, undergraduate. It doesn't seem to matter. This is a highly contagious virus that none of us in the community, regardless of whether we're at Cornell or Ithaca College or TC3 or wherever, are not immune to coming in contact with. So let's see, I think this basically brought you up to date. I did alert you in my report to a couple of important issues with regard to trends in communicable disease. And I certainly would welcome any questions that anyone has that they wish to bring up. Thanks very much.
Thank you so much. Any questions? Comments? Yes, Sue.
So Dr. Klapek, you mentioned increase in national drug overdose deaths. Is that something we're seeing in the county, or is our county too small to note increases?
Well, it's hard, as you say, we do have, relatively speaking, lower numbers. But, we are disturbed by the fact that COVID has isolated so many individuals, and still are concerned that not enough people who are family, friends of individuals who are using opioids and other substances, that they're not sufficiently aware of the need for having Narcan available for emergency treatment of symptoms of an overdose. And we're certainly very, very concerned that individuals during the pandemic have been further isolated to using substances with no one else around, no one who could help them. If they should overdose on the drugs and go into respiratory depression where their breathing is too weak to support life. We're also concerned that it seems to be true that adolescents and young adults, and maybe adults of all ages, are unaware that drugs procured on the street that look like prescription drugs are very likely not to be prescription drugs, and are very highly likely to be laced with artificial fentanyl, a very potent substance that can very quickly put somebody into the situation of having inadequate breathing and cause their death. We believe that not enough people are aware that those drugs they're buying on the street cannot be adequately tested with test kits you might buy at a store to test for fentanyl to pick up these dangerous substances. So we're urging those folks who are finding that they are using drugs procured off the street or drugs in a way that is in excess, that they should be approaching us for supportive care and help and looking to make a transition in their life. Are our numbers going up? I don't have exact numbers for 2021 to be able to share with you, but we had in the past been seeing trends that weren't good, and I can try to get those numbers for you for next month.
Great, thank you. Melissa.
I actually have 3 questions. The first, do you know what the availability of the antivirals for COVID-19 is? I heard that it was increasing and they were stocking Paxlovid in more pharmacies, but initially there was a huge shortage and we couldn't get it.
It's been a couple of, probably longer than that. It may have been a month ago that I last looked at the interactive website to look at who was being listed. At that time, it was largely a particular Kinney's and a couple of CVS's that indicated that Paxlovid, the pill form of therapy for those newly infected with COVID, where it was available. I haven't checked recently this week to see what the situation is, but there are new federal initiatives to try to increase the number of pharmacies offering it. I want to just underscore for those who might be listening in that it's very important if you're going to use these medicines that within just a day or two of becoming positive, you should be starting on them. They are not effective if you don't start them promptly. And 5 days is about a maximum period that you really want to go before starting the drug, and sooner is better. So even within the same day is the best way to go.
I would also say that to know your risk factors, because I think that people don't understand that obesity is a risk factor too. And so talk to their doctors about risk factors. And the other question I have is, does the Department of Health have Narcan available for the public?
Certainly at all of the AED sites throughout the county, Narcan is also stocked there. But I think your question is whether we dispense Narcan to the public. And I believe the answer is no.
Yeah, the health department, the answer is no. There are multiple providers in the community that can train and distribute Narcan. So if you know of an agency or an individual that's interested, Alcohol and Drug Council does it, Southern Tier AIDS program does it, and I think there's a couple of more. So they're getting Narcan And you should be able to also get it from a pharmacy as well. So it should be available in the community.
Okay, and then the third thing is, I know, Dr. Claypack, you had talked about the packaging of the THC, like the kid, not kid friendly, the kid anti-friendly. So the ones that look like cookies or Fritos. Do you know if they've made any headway on banning that?
So there is progress being made at the Office of Cannabis Management. There will be the first meeting of the advisory committee in the month of May to be held. Progress so far in promulgating rules and regulations has focused on a very time-sensitive part of the whole picture, and that being the growing of cannabis itself, THC itself. And so the first rules and regulations with regard to THC that have come out have been for farmers, and in order to know how to go about obtaining a license to grow THC, etc. Of course, other things are equally important or more so, and marketing and packaging and all of that is going to be very important, but has not been specifically addressed at this time. I was contacted by our local regional chapter of the Medical Society of the State of New York, and I shared with them information about what another group was doing in terms of interacting with the Office of Cannabis Management about such things as packaging and safety considerations. And I believe our local chapter is going to be pushing for MISNY to also share and weigh in on those issues to further support appropriate child-proof and, let's say, unattractive packaging that does not attract them to being tempted to use those products that would be dangerous for them.
Thanks.
And just to follow up on the overdose, we had 25 drug overdose deaths in 2021, which was a record year for us. But we've been hovering between 18 and now 25 deaths since about 2016. We did see a couple of months in 2021 where we had significant overdoses responded to by the 911, by our emergency response system, significantly higher than we had seen in past years. So it's not an everyday occurrence that we're above average with overdose calls, but there were definitely some months where they were very high. And to Dr. Claypack's point about fentanyl, we are working on some public information to go out around that issue. I think we talked about that last month. We're still trying to kind of hammer down, what that message should sound like, but hopefully within the next week or so, that'll be going out to get the word out.
Great, thanks. Any last comments on this or questions? All right, Claire.
Hello, everyone. So for community health services, just to brush over kind of some high level pieces, I think Frank and Dr. K already shared about COVID. As we know, cases are up, and so our division is responding to that change in the context and increase in prevalence. We're still monitoring severe illness in the hospitals, monitoring high risk and congregate living, and providing support to any organizations that need it. And overall, we're working with the communications team and our team to just do more outreach and communications as we can. We've seen calls from the public increase lately, just over the past week or so. And then this coincides with the end of the VCC, the virtual call center from the State Department of Health. They are ending across all of the states their support to make calls to positive cases. That ends this week on Thursday. So we put out a press release just to support the public through this transition. And we'll continue to respond to questions as we get them. We have our public health fellows that are working on this to help us with the response. And we also have our new staff member, M. Edmonds, who is our community health nurse responsible for communicable disease primarily. And she'll also support our efforts to continue to respond as we can to support the community for COVID. So we're very happy to have M. This is a role Nanette retired at the end of the year. So we are very excited to have her join the team. I also wanted to just add a piece of news from that wasn't in the report regarding the new funding opportunity that we were awarded recently. It's called the Perinatal and Infant Community Health Collaborative, the PICHC or PITCH grant, and that will begin on July 1st. This was a joint effort between the Health Promotion and the Community Health Services Division with support from other community partners. And it will allow us to expand with 2 new full-time community health workers and a supervisor over the next 5 years and funds to support outreach. The goals of the program are to improve perinatal and infant health outcomes and also to eliminate racial, ethnic, and economic disparities in those outcomes. So there's a real emphasis on coordination and collaboration with other service providers and community organizations to do this work. So there'll be more to come, but I just wanted to share that exciting news. And it is aligned with our vision and strategy, and certainly with our strategic plan. So we're excited to use this to increase our impact. The final piece I wanted to just touch on in case anyone had questions, it came up in prior meetings. There is a Peace of Mind meeting that's scheduled next month on the 23rd of May. And that's a meeting that happens once a year to discuss sexually transmitted infection prevalence in Tompkins County, coordinate messaging, education to community, and the response. So we'll discuss updates from the New York State Department of Health and best practices. And just wanted to mention that was on the books. So thanks. I don't think I have any other updates.
Great, thanks, Claire, and congratulations on that grant. That sounds like a great addition to the community. Okay, any questions for Claire? Or question or clarifying? I think it's needed.
I just have a kind of an interesting additional point about COVID testing. It came up this past week with regard to a 4-month-old. And the bottom line is that the antigen tests that are available, none of them, to the knowledge of the American Academy of Pediatrics, are approved for children under the age of 2. So parents and other individuals interested in getting a child under the age of 2 tested really should opt for a PCR test. None of the antigen tests, to our knowledge, have been approved for that purpose and therefore shouldn't be relied upon.
Okay, thank you so much. Okay, any other last points as we shift away from community health and health promotion to special healthcare needs? All right, Deb, you're up.
Good afternoon, everyone. I really don't have anything additional to add to my report.
Thank you. Any questions on Deb's report? Okay, our county attorney, Bill. You're on mute.
Sorry about that. I'll do this quickly. My news is I am just getting over COVID diagnosis. I can't say enough good things about the folks up at the testing center. I was in and out of there so fast, I almost thought I must have missed something here. My wife came down with it. A 31-year-old son who's been home for a few weeks just to get a change of scenery is fine. So go figure. But I feel fine. And For those of you who've been looking for me, I haven't been around for the last 5 days, but I had a good excuse for it. So
Well, we're glad you're feeling better.
I felt like I had a head cold and I was tired all the time.
Yeah.
Very interesting.
Well, welcome back.
Thanks.
Okay, so Skip, I think it's you for environmental health, correct?
Yep.
Okay,
It's-
thanks.
Hi, everyone. Yeah, just a couple quick updates that aren't in the report. We do have a EH technician starting on Monday, so we'll be at full staff for at least a couple months. And also, I wanted to report that last Monday, I did give a brief presentation to Health and Human Services on tobacco/vaping enforcement. Reality Check joined us for that. And then one last thing is, so you don't have to ask me, Christina, I know last time you did, there will be an enforcement action forthcoming for grassroots in May. So just a heads up on that. That's all I have.
Thanks, Skip. Any questions on environmental health? That's probably the extent of what we'll discuss on that today because we don't have quorum to be able to go, but it looks like, I think all of your enforcement actions this time were about vaping, so, or the vaping products, so, okay. And so maybe just a point of clarification on that, is that, can we roll those to our next meeting? And that works for the health department?
Yeah, we'll have to.
Okay, thank you. Any questions for Skip? Sue?
So I'm just curious as to whether these stores don't know that they're supposed to be not selling these flavored nicotine products, or do they just think they're going to get away with it?
I think most of them know that they're not supposed to be selling it. I had one facility who they were in transition of purchasing the store, and the inventory came with the sale. So he's claiming that, that was the case in that situation. I had another store that indicated that they knew and they were hiding the fact that they were selling it. But because of demand for the product and the fact that other stores had been selling it, they didn't want to miss out on that. So for the most part, I would say stores know that they're not supposed to be selling it. And just so you know, this is only half. We have another 4 stipulations out there for the sale of flavored vape. 2 have signed the stipulation, and the other 2, I'm still working with the operators on getting those stipulations signed, or they may end up going to a hearing.
Okay, thanks, Skip. Other questions?
It's a tough job, Skip.
Yeah.
Yeah, to be kind of put in the place of enforcement. I really applaud all of you guys, getting out there and looking out for our underage folks.
Yeah, I think the challenge was with COVID, we were, we went to a complaint-based enforcement, so we weren't out there. So we really had to condense everything, January, February, March. We were basically trying to get out to all the facilities at that point. So that's why you're seeing a lot of actions. And I think in some cases, facilities thought maybe we forgot about them and got a little laxed, especially with the underage sales.
Okay, thanks, Skip. Harmony, I'm going to shift to you for our Community Service Board partners.
Sure. So in our last Community Service Board meeting, we had continued the conversation we'd started the month before around some of the things Dr. Klaypeck was just talking about, fentanyl being laced in many of the drugs that people might be using on the streets. One of the things we identified as an area for further exploration was the need to ensure that mental health and substance use treatment can be provided together. If a person is struggling with their mental health and they're going to a substance use provider, that provider needs to be able to do some of that basic mental health work and vice versa. So this next month, we'll have Rich Shaw, who's our dual recovery coordinator, coming to talk to members of the board around his work in trying to support and improve that coordinated care approach in our community. Other than that, we discussed our bylaws a little bit more in detail, and the nominating committee was doing some work. So that was our primary discussion. Thanks.
Thanks, Harmony. Any other questions for Harmony? Okay, so in looking at the agenda, we will need to roll the approval of our March minutes as well as all of our enforcement actions to our May meeting. Okay, so just to finish up, we have a few, if we don't have any other new business that I'm aware of that I need to put on here. Okay, so if we can just finish up with the few updates around the merger, and then also we have a hiking trail initiative that we need to talk about real quick. So Frank, did you want to? Okay, go ahead.
Sure. Just
expecting Frank to be here, so.
Yeah, so just a quick update on the merger. So the group met with Iron Designs. Our cross-functional team that's working on branding met with our consultant, Iron Designs, to do the first step, which was discovery. I think we had a really good 2-hour meeting with him. It was kind of fun to talk about the ideas and share. I think it was good that we selected a local vendor because he was very familiar with the local landscape. And so we were able to really focus on us as an organization and, you know, what we're hoping to achieve. So we're in the process of reviewing his summation of that meeting. And then they'll be launching into starting to develop some of the creatives. So we're excited that process continues to unfold. We have another cross-functional team that's been working around us understanding more about what each other does throughout the joint department. A network map was completed and is now the survey is now being analyzed to kind of paint the picture for what, where we might have some opportunities to improve understanding of each other and relationship building. And we're in the process of looking at how we can better integrate our children and youth services and ultimately with the creation of another cross-functional team. But right now the senior leadership is putting some framework together for a charter and scope for a potential another cross-functional team to work on that. That one has a lot of excitement behind it because I think we'll start to be talking about co-location in the different buildings and possibly, universal intakes and those kinds of things where we'll be able to have quick and efficient referrals to the many different programs we offer. So I just wanted to give you an update. There's a lot of work going on there. And there is bylaws work continuing. The Community Services Board, as you heard from Harmony, is working on theirs. Christina and the subgroup have been working on the Board of Health, and I got to do some linking from the bylaws to public health law here in the next few days, and then we'll be sharing that out for the broader group to take a look at. But those are the big things that are going on from the merger right now.
And then Frank, I just, you might have said this and I missed it, just as a reminder, because I know that you sent it out while we were talking, that the brand summary document that was shared with the entire board, if you can take a look at that, because comments are due today on that. So if you've got anything, any reactions to that you want them to be aware of.
That's not from the board. That's for the group. I didn't send
that's not for the whole board yet.
Yeah, no, you're a copy
okay,
on
that's
that.
Just me. Okay,
Yeah.
thank you. Sorry, sometimes I get confused what I'm doing, so.
Right. I had a
Okay.
moment of panic for there that I sent it to the
No,
wrong-
that's okay. So sorry about that. That's just for me. And then the other piece that the board should expect to get from us is the edits to the bylaws. And I wanted to thank Sue and David for their comments on that. So that's sitting with Frank. We should hopefully get that back to you in the next week or so, and then we'll be able to discuss that at our next board meeting. So that's coming. Okay, so any other questions on the merger or where we are with that? Okay, so the last piece for discussion is there was a request that came to the Board of Health, and who within the Department of Health handled this? Frank, did this come to you or did it go to one of your divisions?
It came to Brenda.
It came to Brenda. Okay. So this is a request for us to write a letter of support related to hiking trails. So within the board packet was and at the very, very end of the board packet was the initial request that came in on this. And then Karen was kind enough to send around to everybody, I think, the actual letters of support that would be going out. So I just wanted to get some feedback from the board if there were any concerns about us signing on to that. Because otherwise I would go ahead and support that from the perspective of the Board of Health. Okay. Okay. Frank, Frank or others, is there anything else? If not, I think we've covered everything we can on the agenda. And I think we've also lost Melissa probably to a patient at this point. So that's probably a sign that we can go ahead and adjourn. Okay. All right, everybody. We'll see you in May. Have a good month.